Hello, everyone. This is Ann Cuppinger from the Community Technical Assistance Center, and I'd like to welcome you to our webinar, Youth Peer Advocates and High Fidelity Wraparound, Perspectives and Perceptions of the Youth Peer Advocate Role. And we are really fortunate today to have three wonderful presenters. We have Ruth Lindenfelser, who is a Senior Research Support Specialist with the Center for Human Services Research at the University at Albany, where she is a member of the New York State System of Care Evaluation Team. We have Ashley Rivera, who is the Youth Wraparound Implementation Coordinator with the New York State System of Care Team, and she works for Families Together and Youth Power. And we have Azaria Georgia, who also works for Families Together in New York State on the Youth Power team, and she is the Youth Peer Services Training and Credentialing Coordinator. And they're going to share with you some of their experience in the New York State Wraparound System of Care Initiative, and I think you'll really enjoy this presentation. So without further ado, I'm going to pass it off to Ruth.
Thank you, Ann, and good afternoon, everybody. I'm Ruth Lindenfelser. I'm a social worker and part of the evaluation team for the New York State System of Care pilot study that we're doing here at the Center for Human Services Research. Part of what I've been doing on the evaluation is data collection, which means I've had the privilege of talking with families and with youth, as well as providers about their experiences with high fidelity wraparound. So I have a tangible connection to what I'm going to be talking to you about today. So we first presented this data at the New York State Families Together conference back in May, and we're asked to now offer this up to folks here with the Community Technical Assistance Center of New York and folks in the broader community who access CTAC for relevant information. So thanks for the invite, CTAC. The discussion about youth peer advocates is timely and relevant as we in the industry see the youth peer advocate role continuing to grow alongside Medicaid reimbursement. So it's important to understand how youth peer advocates help young people in various service processes in which they may participate, including wraparound. So some of you may be providing peer advocates in a clinical setting with youth who are struggling with addiction or in other settings. So as I share some of this data with you, keep in mind our evaluation is looking very closely at a specific intervention, high fidelity wraparound, which is an evidence-supported process and a very prescribed form of wraparound. Wraparound happens in many contexts, so it seems this information is valuable for us to hear today. So I want to tell you a little bit about the Center for Human Services Research. We're located at the University at Albany. We have over 25 years of experience with conducting evaluation, research, informing program and policy development for a broad range of agencies that serve vulnerable populations, as well as we do work on designing information systems. And you can see up on the slide some of our project areas, and that our New York State System of Care evaluation falls into that behavioral health category here at the center. So that behavioral health in that purple font. So now I want to introduce my co-presenter, Ashley Rivera with Youth Power. And she's going to speak to high fidelity wraparound, the principles, and the role of the youth peer advocate in high fidelity wraparound. She's the Youth Wraparound Implementation Coordinator on the New York State Systems of Care grant and has hands-on experience with this role in high fidelity wraparound. So take it away, Ashley.
Thank you, Ruth. So I'm just going to give an overview of what high fidelity wraparound is and what it looks like for youth peer advocates who are using this process model to serve families. So high fidelity wraparound is a family-driven, strengths-based, solution-focused planning and problem-solving process. It's individualized, which means that every family gets a unique plan that fits them and their beliefs and values, not the cookie-cutter plan that everyone else gets. It's strengths-based, which means that wraparound plans help you build on what is working in your life instead of focus on exclusively what isn't. Family-driven means that the plan is centered on families and the whole family. So if that includes siblings, grandparents, aunts, uncles, whoever that family identifies with who is a part of their family. Wraparound helps families achieve important changes by helping them meet their unmet needs. The main purpose of Wraparound is to help children and adults around them have the kinds of lives they want to have, or at least gets closer to them. Wraparound offers practical compassion to people who are in need and want to improve their lives. The people who provide it help families organize what they need to achieve those improvements in a sensible way and bring appropriate people together to help them do it. The principles of Wraparound are centered around the family and the youth, as you can see in the middle, and it represents family voice and choice. And then the principles surrounding it, which are individualized, strengths-based, natural supports, collaboration, unconditional care, community-based, culturally competent, team-based, and outcome-based. So these principles provide an understanding of this new delivery model. The principles guide the work of service providers, which are youth peer advocates, family peer advocates, other providers from other service systems that the family might be involved with, and also their care managers. And so they work in collaboration and partnership with families. These principles are an important basis for measuring the fidelity of wraparounds. So now to the role of youth peer advocates. So youth peer advocates are generally young adults from the ages of 18 to 30 who have personal experience within the child and family serving system. So that's mental health, special education, child welfare, and juvenile justice, and who are interested in ensuring that their peers receive high quality services that are responsive to their needs. The YPA's role is to gather information from the youth about their strengths and challenges, prepare them for team meetings and help them connect with other youth and with other natural community supports. The YPA supports the youth in finding and expressing their voice and sharing experiences. They prepare them for team meetings. The youth in the YPA will discuss what to expect, who should be there, and how the meeting will work. At times, the YPA may speak for the youth or, in partnership with them, talk about things in the meeting until the youth are ready to do it on their own. In situations where youth may feel outnumbered or be reluctant to speak about their needs, the YPA is there to add another youth voice and advocate on their behalf. And then the goal is to help the youth develop their own abilities to advocate effectively for themselves, both in meetings and in the community. And so I'm going to pass it off back to Ruth, and she will discuss some of the data.
Thank you, Ashley. So that was really helpful to provide some context for us. New York State is implementing high fidelity wraparound through a system of care pilot study. So the Center for Human Services Research has been working on the evaluation of this pilot program. We're currently in year 3 of the evaluation, and we've been evaluating the implementation. So how is high fidelity rolling out across sites in New York State? We're looking at fidelity to high fidelity wraparound. So how is it adhering to the New York State wraparound model? And finally, we're looking at outcomes. How is high fidelity wraparound impacting families? Today, we're going to be looking at the data from the implementation phase. So in order to answer how high fidelity wraparound is being implemented, we talked with families and youth providers, we surveyed administrators, we looked at notes that youth peer advocates keep to document their activity with youth and with families. And here you can see the data that we looked at. And so what we've ended up with is a multi-source or holistic perspective on that youth peer advocate role. And so now we're going to kind of parse out each data source and see what they have to tell us about youth peer advocates. Youth peer notes are service notes that document the activity between the youth peer advocate and the youth. Our state team developed a format for youth peer advocates to use, and we analyzed the notes and were able to glean lots of details about the work that youth peer advocates were doing with youth. We looked at roughly a year's worth of notes from like the fall of 2017 through the end of 2018. These data were taken from a documentation platform developed by the New York State Office of Mental Health, which was used in the early days by care managers, family peer advocates, and youth peer advocates to document their activity with families. The system tracked a lot of details, and that helped us take a deeper look into the work that was being done with families. So within their notes, youth peer advocates were able to indicate who they were working with and where the work took place. So looking at the pie chart on the left, the coding of the notes revealed that youth peer advocates were working with families and youth, both individually and combined. They were also working with community providers, so school personnel, mental health, probation, as well as fellow team members, so care managers and family peer advocates. Looking at the pie chart on the right, we see that peers were meeting with families in the home, in the community, like in parks, and schools, and psychiatric hospitals, libraries, mental health clinics, malls, as well as the office. So we can see their time spent with youth is consistent across these settings. 2/3 of their time is outside of the office. So these providers appear to be getting out and meeting youth where they're at. We also learned from the youth peer advocate notes how youth peer advocates were communicating with youth. So much of the work is happening one-on-one with youth, which helps facilitate some of the work the youth peer advocates are doing with youth. So that advocacy, that skill building, that engagement. But it's also happening in a form that's relevant to young people. It's happening on the phone and texting. Peer notes also let us see what type of work was happening. Now, this chart shows us examples of the youth peer advocate service categories that are part of the Medicaid redesign and future billing categories. In this early iteration of notes that we coded, care managers, family peer advocates, and youth peer advocates were able to identify a service area, one of these service areas that characterized that particular contact with families. So here's a breakdown of what type of work the youth peer advocates checked off on their notes as happening with the youth. So again, we can see here 85% of the activities documented fall within those service categories that will ultimately be Medicaid billable services. 15% of the notes we coded simply did not have a category selected. So next we looked at the content of these notes in order to see what the activities in each of these service categories looked like. So if we start with skill building and that slice of the pie and kind of go clockwise around the pie, we'll hit each of these categories and see what is happening in the notes. So some examples of what youth peer advocates were doing in that skill building category included a youth peer advocate helping a youth develop coping skills for their first week on a new job. The youth peer advocate helped a youth develop a budget and learn some money management skills. Help was given to the youth in learning how to use public transportation to get to work. The youth peer advocate supported the youth in expressing their feelings at a meeting, kind of like Ashley had mentioned that in her description of what youth peer advocates are doing with youth in high fidelity wraparound. So in that coaching slice of the pie, we saw evidence of a youth peer advocate sharing their history, their own history of gang involvement, which then helped the youth to open up about their own history and involvement with gang. And a quote pulled from one of the notes by youth peer advocate says, "I knew that the youth was involved in gangs and the lingo, and the youth shared their affiliation." So we see a ready sharing of information between the youth peer advocate and the youth. We also see in that coaching pie slice, the youth peer advocate supported a youth through crisis, assisted the youth in developing a plan to resolve the crisis. We see youth peer advocates sharing with youth their experience with a particular medication that the youth is also taking and coaching the youth on how to talk to their doctor about side effects with that medication. In that engagement slice of the pie, we see evidence of a youth who is hesitant about high fidelity wraparound, but through the interview process and the first CFT, the youth came to realize that their voice was a valuable part of this process. We see evidence of the youth peer advocate meeting with the youth to develop a timeline of their life and identify goals for the future. Youth peer advocates were making themselves available to listen at times when youth needed to talk. Youth peer advocates engaged in some strategic sharing with a caregiver to demonstrate how the youth peer advocate got through a difficult time similar to what their youth was going through. In that self-advocacy slice of the pie, we see a youth peer advocate supporting and visiting youth during a psychiatric hospitalization and continuing that support through discharge and return home. We see youth peer advocates attending school meetings with youth and helping the youth advocate for themselves. Youth peer advocates are supporting youth and advocating for themselves in relationships. Through deep inputted conversations with youth, youth peer advocates were able to demonstrate to the youth the progress that they themselves had made despite setbacks, and the youth was encouraged to kind of continue making progress. And in that final slice of the pie, we see in community connections, we see the youth peer advocate accompanying the youth to the mall via public transportation, preparing the youth to take public transportation, and this helped that youth feel more supported in their pursuit to gain independence. We saw evidence of another youth who was anxious about community outings, and the youth peer advocate worked with the youth to increase their confidence in getting out into the community. Surveys of administrators are part of our annual data collection that we do to understand the strengths and weaknesses and opportunities for improvements of the project implementation so far. And by year 2, which is the data we're going to be looking at today, sites were up and running and counties had some experience with implementing Wraparound. So at that year 2 data collection point, we had 17 unique responders from 5 different counties, as well as the New York State Office of Mental Health. Some of the survey questions looked at items like the preparation leading up to implementation, how Wraparound was impacting families, suggested improvements to the project, what was going well, the peer impact on families. So it covered a broad series of topics, but also included some items specifically about that youth peer advocate role. So here we see responses to one of the questions on the survey, which was, which of these roles, and it listed out the care manager and then the youth peer advocate and the family peer advocate, which of these roles is a positive addition to the triad? And for each role, the respondent was able to answer, yes, this was helpful, no, it was, yes, it was a positive addition, no, it wasn't a positive addition, or I don't know. And as we can see in our lovely purple pie here, that an overwhelming majority of administrators responded yes. Youth peers on the team were a major strength of High Fidelity Wraparound. Next, we have some responses from a couple questions on the survey which looked at project success and peer impact on families. So that first question, what has been the most successful thing about the project? And we see here one response, the children are responding to the peer support, and then the team is more effective. Another response to that first question was families who have been involved with the system for years, who have made very little progress, are now improving significantly in terms of youth not being suspended from school, families reporting more satisfaction with each other, and youth being able to avoid hospitalization. Looking at that second question, please describe how you feel families are impacted by peer involvement. We see that the families love the youth peer support and the care managers have time to spend with families since they have a smaller caseload. Another response to that question was the flexibility, family-driven and youth-guided, strengths-based approach enhances engagement. Families overall find the model very supportive and relevant to their immediate and long-term needs. And one other comment to that question, the use of the peer advocates has made a huge difference in terms of getting to the underlying causes of issues in the family so that issues can be more effectively addressed. Provider interviews are also completed annually, and this data that we're going to see is also from our year 2 interviews. We are currently in the midst of doing year 3 interviews, so the data from those interviews will be for another presentation. But again, by year 2, these providers have been trained. They had some experience in implementing Wraparound. They had some experience under their belt. The interviews were administered in August through September of 2018 as part of our annual data collection to, again, understand those strengths and weaknesses and opportunities for improvement. We talked to youth peer advocates, family peer advocates, care managers, as well as some of the folks from the New York State team, some trainers, and some coaches. And we interviewed 26 people from 6 different counties. The questions looked at items such as what helps families the most, how a provider's specific role contributes to wraparound, and what are some of the benefits and difficulties. So here's one question that we asked in the interviews. How does your role uniquely contribute to wraparound? And here we see bringing a comment from a youth peer advocate, bringing lived experience to the table, reminding the family about the youth, talking to and empowering the youth. They know for the first time that these meetings are about the youth. Other systems don't do that. Another response from another youth peer advocate was, I understand what the family feels, or I'm a shoulder to cry on when they don't want to tell anyone how they feel. Another question that was asked, in what ways, if any, do peers enhance the wraparound process? And here we see from a family peer advocate, the youth could share experience with the youth peer advocate. They share hope. The youth's face would light up. The youth felt heard. Youth could share their voice without fear of being disciplined. The youth peer advocate facilitated that. Another response from a care manager, sometimes the strongest relationship in the unit is between the youth peer advocate and the youth, and we rely on that to drive the case forward. Another youth peer advocate commented, the youth gets a voice. There's less of a chance of the youth's needs getting pushed under the rug. Another youth peer advocate said being able to say, I've come through it, gets more buy-in than I went to school and I know all about it. And one final comment that a care manager made was that the youth gravitates towards somebody who can relate to them. They see hope that they can turn things around. Some of you may have heard of or attended the recent Wrapaganza. This is a New York State OMH-sponsored annual event that offers workshops and presentations on various wraparound topics. And this last one took place in August of this year, and attendees included providers, trainers, evaluators, and families from across New York State. A survey was administered by the Center for Human Services Research to all the attendees, both via paper and mobile device. So this slide shows responses to one of the questions on the benefits of the system of care high fidelity wraparound model. And on the left, you'll see some of the benefits that we were asking about: emphasis on family voice and choice, inclusion of peers, increased cross-agency communication, improved child outcomes. And so the responses that you see in red include all the attendees at the event. So care managers, youth peer advocates, family peer advocates, evaluators, state team, families. And the inclusion of peers was the second highest benefit noted by all 48 respondents. Now, you'll see a blue bar, and the blue bar represents all peer responses which were taken out. So they were all excluded. And we still see that the inclusion of peers was ranked as the second most beneficial element of high fidelity wraparound. So about 2/5 of the respondents were peers themselves. When their responses are excluded, we still get 78% reporting the inclusion of peers as a benefit. So 3 years into this evaluation, the inclusion of peers is still viewed as a positive element of high fidelity wraparound. So finally, it's important to hear feedback about wraparound and the peer advocate role from those who are receiving the service. So interviews with caregivers and with youth happen at baseline, and then at 6-month intervals, and finally at discharge. And we have a constant influx of new families as well as families discharging. So data is continually flowing in and out. These interviews provide an opportunity to gain feedback from families on the peer advocates and on wraparound. Caregivers and youth are asked the same close-ended, scaled questions, and then the interview ends with an open-ended question. So here we see data from a question in the youth interview in which we're asking the youth to rate their response to a statement about the youth peer advocate. So this data was updated to reflect responses through August of this year. Here we see that youth reported that youth peer advocates are more often encouraging youth to use their voice and to help them progress on goals. And they reported a less frequent experience with the youth peer advocate lowering stress and relating to them. It doesn't mean that that wasn't happening. It just means that they reported on it less. So again, we see evidence of that advocacy and the coaching skills that youth peer advocates seem to be using effectively with youth. Now the interview ends, every interview from the 6-month point, collection point on to the discharge ends with an open-ended question, which is, do you have anything else that you want to share about your experience in wraparound overall? Both the youth and the caregiver are asked this. We don't prompt them to provide feedback specifically on peers, but here's what they told us. So we see from a caregiver, I adore the family peer and youth peer advocate. They're amazing. They get it. They get us. The youth peer advocate checks on the youth all the time and stays in touch. They're all about helping, and they listen to both sides. No judgment. I feel I can open up to them about anything. We see a youth who said it's been fun. I wouldn't give it up for nothing. I'm bonded with the YPA. Wraparound is always there when I need somebody. They push me to do my goals. The youth peer advocate, the family peer advocate, and the care manager all work together as a group. They helped the family tremendously. They helped strengthen the bond with the caregiver. They helped the family through tough times. Another caregiver said, I think they're wonderful. They're always there. They're great people. And finally, another youth said, I have a good bond with the youth peer advocate, and that helps. If the youth peer advocate didn't join the program, I don't know if I'd be doing as well as I am. So I thought a word cloud taken from the provider and team interviews question might be another way to demonstrate the impact of the youth peer advocate. So as you know, words in larger font appear more often. And so this was taken from a question that we looked at earlier. In what ways, if any, do peers enhance the wraparound process? And we see the word youth kind of jumps out at us. We see other words clearly like enhance, together, helps, better, benefit. So you've heard already how the youth peer advocate has enhanced the wraparound process, brought families and teams together, how they were helpful and made life better and were a benefit. And I thought this was a fun representation of that. So for the win, here's what we've learned about the youth peer advocate in high fidelity wraparound. Administrators, care managers, family members, and youth all agree youth peer advocates are a positive addition to the wraparound team. Youth peer advocates work closely with youth and caregivers in a variety of settings. They work on many types of needs, primarily engagement, bridging and transition support, and coaching. Youth peer advocates bring lived experience, which provides youth with a sense of hope and keeps the focus on the youth, which helps the team to be more effective. So I'm going to pass this to Azaria.
Thank you, Ruth and Ashley. This information is so valuable and impactful. I could literally listen to it over and over again, so thank you. I just want to share with everybody the Youth Peer Advocate listserv. We hope that you'll join us through this listserv and sign up, and you can stay up to date on all things pertaining to Youth Peer Advocates, including upcoming training, credentialing updates, resources, supervisor support, and professional development opportunities for youth peer advocates and supervisors, agencies alike. And you can find this right on the Youth Power website under the workforce development, or right at that URL provided at the bottom. I'd like to welcome everybody also to take part in our Y Youth Peer Advocates Part 2. The recording of Part 2 can be found on the CTAC website. You can click the tab for upcoming events and find the recording and slides on September 24th on the calendar. So Y Youth Peer Advocates Part 2 is really focusing in on a panel. So this is a panel of presenters. We have youth peer advocates from upstate New York and New York City sharing their experiences. Alexis is a young person that not only receives services, but is actually a youth peer advocate currently now. And her mother will be joining us, Narda. And Katie and Tiara are both supervisors and former youth peer advocates, and they all will be sharing their experiences with the youth peer advocate role. So we really look forward to you joining us and asking them questions. Here's some additional resources also. Youth Power offers our regional youth partners throughout all of New York State to support you and your agency with the implementation of youth peer advocates. And we also offer information on the youth peer advocate training and credentialing on our website. So we hope you'll take an opportunity for those. We also have, check out our previous webinars also on how Youth Power can support your organization, effectively employing and supervising youth peer advocates, what is the role of a youth peer advocate, and then the Youth Power overview of youth peer advocate credential and training. And here's our contact information. And I'm actually going to pass this over to Anne now.
Thanks very much. This was a great presentation. I really feel like I learned a lot about how youth peer support is being implemented and how well received it is by the agencies that are providing it and the young people and families who are receiving it. So not only do I thank our presenters for their time doing this webinar, but also for their hard work out there implementing this, this really important service. If you have any questions about the research study, obviously you can contact Ruth. Any questions about the system of care, implementation, Ashley would be a great person to touch base with, and Azaria will be able to answer any questions you might have about youth peer advocate training and credentialing. And if you're a family or a youth who is interested in receiving this service, you can contact your regional youth partner. Their contact information can be found on the Youth Power website. And if you have difficulty navigating that at all, I'm sure Azaria can point you in the right direction. So thank you all very much for joining us, and I hope you'll check out part 2 of this series as well.